I'd like to call the Social Services Subcommittee to order. And I just have a question. Are we still switching back and forth? Like, is Graham doing it one time, then I'm doing it the other time? Or doing the COVID, we're just going forward with the same chair?
Through the chair, we were completing the switching between the vice chair and the chair. Unfortunately, there were a lot of issues when we were completing that on our own. So we've sort of just been letting the chairs, the vice chairs contact us, and then we'll schedule that accordingly.
Okay. Sorry, I just realized I didn't have my mic on. I mean, I had my mic on, but I didn't have my volume on. So I caught most of that. And I realized you were talking. But anyway, we'll call this meeting to order. And any declarations of pecuniary interest in the general nature, therefore? Seeing none. Delegations, there's none scheduled. So the report of the Director of Social Services, that the report titled Social Services Relief Fund Phase 3 allocation be received for information. And would you like to talk a little bit about that?
Thank you, through the chair. As you know, previously in the last year and a bit, the MMAH has been giving allocations to help with COVID when we're dealing with housing and homelessness. They announced and they announced a phase 3 allocation on March 10th. The province has stated that. In which the service manager will receive 1.1 million in provincial funding. With this, we always have to submit a business plan as to how we wish to allocate it. It's we have to utilize this money by December 31st. And I'll probably go into the third report and this report in the same, but where we're focusing the efforts, or where we're seeing some pressures now, is as we're going to move into the recovery end of things. We still have emergency accommodations that we're seeing numbers within that are higher than our typical non-COVID phase, but we're also looking at how to capitalize and implement a housing-focused emergency, rehousing people, as well as what we're seeing in the community housing buildings and supports for that, enhanced services, as well as some street outreach. So those are the areas that we still are looking at as to how to look at service gaps and utilizing services for that. So that's our initial plans for this money as we, what we put forward in the business case that was approved by the ministry. So that's the report on social service relief. And I do have Alex on the line if there's questions as well, because he helped with the business plan for this one.
Anybody got any questions? Jody?
Yes, thank you. I was just curious, did the province give any sort of guidelines as to how the money could be used? Because it had to be specific services that were supported?
Through the chair, this was operational funding, no capital, that with timelines and specific to the outlines of where it had to go. Yes.
Right, thank you.
Graham?
A question about do we have enough capacity to make sure we spend all of it? Or I take it that we do have enough items and that we can get a chunk of it?
Through the chair, as in the third one, I do believe we're really looking at operational and capacity building within the community. The issue continues to be that this is one-time funding, and I'm very hesitant or cognizant that we are putting in services that I'm not sure down the road. Ideally, I don't want to see a large impact if the funding doesn't continue as to where the gaps in these services will be. So we're fairly cognizant of where we're building capacity and ideally looking at what's working and hoping to maintain the service delivery in those models.
Any other questions? All in favor of receiving the report? Carried. Okay, next up, sort of sad news for sure. Staff recommendation that council repeal the bylaw authorizing the signing of the contribution agreement for the Social Service Relief Fund Phase 2 holdback with the Ontario Ministry of Municipal Affairs and Housing for the construction of 8 modular supportive housing at 398 Erie Street, Stratford, in light of the city's application being denied. And I see in the report it was overwhelming how many people responded, and it's sad that, and it's not something we really can go forward with on our own, I'm assuming, because of the operational costs, because you have to have support staff and
So,
right.
yeah, well, through the chair, we would have looked at operational costs coming from the Community Housing Prevention Initiative. It was the capital that we were not able to maintain at this point. We do recognize the need and continue to recognize the need for supportive housing. This would have been a great pilot project to start. We're going to keep looking at it. We're going to figure out because we know there's a need in the community. It does look like we're hoping that there will be a second round, which we will continue, that we will apply for, and we'll look at other funding models, because if we can get the capital, I believe we can repurpose CHIPPY money or work with other service providers, other ministries even, for operational, talking with the LIN or talking with other municipalities as to who can we leverage funding for operational. So I am hopeful and positive that we will see this project come to fruition down the road, just not under this model.
How much was the total cost for the capital? Do you have that there? I couldn't find it in the report. I could find.
I do not want to comment. Just 1 second here. It's 2.4 million. Was
2.4 million?
Yes.
I was going to say, I wonder if we can find that somehow, but that's quite a bit, isn't it? Anybody else have any questions, or did you have anything else you want to talk about with that, Kim, at all? Or
just again, the full recognition that there's a need for this housing, and we will keep trying and looking at all areas to try to make this project successful down the road.
And I think it's going to be harder and harder because more and more communities are raising awareness about the homelessness issues in all the cities across Canada, right? Municipalities. And so there'll be more and more people applying, and it's going to make it harder.
Yes, yes, it will. And the building costs as well. And through the chair, I just see the manager of housing, manager at Eden.
Yeah.
Can you maybe comment, you were on a teleconference, sorry to put you on the spot as you come in, but about the building costs and some of the RHI models that we've been seeing for those that were successful?
Yeah, so apologies for my lateness. I was double booked and thought this was at 4:30. Sorry, the cost. So Kim would have explained that we had that there was only 2 non-Indigenous communities all throughout Ontario that actually got, and that had to do with the ranking. But one of the communities that did get the funding actually was commenting they wish they hadn't, because the costing, I'm sure you're seeing with development costs, are just going skyrocketing. Where they were looking at for modular housing, hold your hat, 600,000 a unit. Yeah, so it's not a cheaper way. I don't know if they're marking up because there's no, modular units, or there was such a competition, but they were really having to rethink the whole, like, we're doing modular because that's a requirement that was under that funding, not necessarily because that's the most cost effective. And I think, sort of putting that frame as we go forward, thinking about Britannia Phase 2, it may be something we look at a different kind of building form, like maybe we're looking at concrete versus wood right now, because it used to be that wood was cheaper. That's not the case right now. Anyways, long way of saying we're not giving up on this proposal. We really love the idea of doing some kind of permanent supportive housing. They're looking at another funding round for this. We are looking at other possibilities. Can we put more units on that site? Is it an opportunity for us to look at the planning and rezoning? So permanent supportive housing is in our plans. We just got to figure out how to make this work.
So we're going to continue to use the building as we are right now?
Yes, right now it's just sort of been this transitional shelter. I actually have temporarily one of our building monitors in there because we were doing a little renovation to his unit. So we're using it that way, like we just sort of place people temporarily there. But yeah, we'll continue. We're not going to keep, we need housing. We'll use it to some degree as we move through planning.
Is anybody else? Graham?
Just a comment, really. It would appear to me, if my math's correct, that if there's 179 projects approved and confirmed for $500 million, that means the average would be almost $3 million for each item. So I'm not sure what sort of projects they are, and I'm assuming there's some that are way above that and some that are way below it. But regardless, it seems like a lot of money. We were asking for, was it 428,000?
So through the chair, we were asking for 2.4, but we were going to use, what's important to note is we were going to use SSRF funding capital. They allowed a certain portion, and we then that since we were unsuccessful with that project, we weren't able to use the SSRF capital portion. So it kind of double whammied us on that.
Sorry, I misread that, sorry.
And through the chair, I also believe that they're, whether they were leveraging, even is it Kochi in some of them, or OFI, they were leveraging OFI with this, and also some municipalities were putting it on their tax levy as well. So there's multiple funding streams that could have been looked at.
Yeah, so through you, Madam Chair, one of the things we've heard is, so there's a few communities across Ontario that have permanent federal funding through a program called Reaching Home. We've applied in the past, but have not been successful. There's only about a dozen in Ontario. They tend to be the big cities like Waterloo, London, Hamilton. They already got a lot of money for this, and some of them even applied for additional funding. So I think the 3 million is correct in the sense that they were using, but it wouldn't have been the cost of the development. They were using it to leverage other funding. So they may have pulled together municipal, provincial, and as well as the federal.
Kathy?
So am I correct that the SSRF funding, then we can't use that funding now, or we would have to come up with another project, or it's gone money?
Through the chair, with the timelines, we were not able to because we had to have it committed by January 31st, and this decision didn't come past that. So
yeah,
so
and that's
example.
Yeah, another example of you have to use it really quickly or use it.
Yes, we
Yeah.
need to have shovel-ready projects, and that's where Eden and I are turning our heads to. But in this case, the timelines were not conducive. The answer was later than we anticipated as well because of the overwhelming applications. So we were not able to do that.
Well, that's too bad that we can't appeal that and say that we didn't, we didn't find out till too late past the January deadline. I'm sure other providers are having the same problem.
Through the chair, I assure you I tried.
So now we have to turn that money back in. Is that how that works?
We never, through the chair, we never received it to
Oh,
begin with, so it wasn't quite, yeah.
Anybody, Kathy?
So I think this is where recently we did support a motion from another municipality around dealing with these tight timelines and dealing with the inability to actually sort of, get onto some of these. And so I know that we supported another municipality, but I think it would be interesting for us as a council to send our own correspondence to the province to talk to point out this issue, and especially smaller municipalities. We simply don't have the capacity or the number of projects lined up to be able to use some of this funding. So I'm not sure where this starts, but I mean, maybe once we deal with this recommendation, I'll make a motion that could go through council for this.
Jody?
Well, one good piece of news, I guess, is that now we have a shovel-ready project, sort of. I mean, we just need funding for it, but the plans are all there. And so the next time around, we will be able to jump on it a lot faster. And I was going to move the staff recommendation.
Thank you. Any other questions or comments? And thanks for all your work on this, trying to get this, but anyway, all in favor? All in favor? Carried.
So,
Let's see, next on the agenda.
so Bonnie, could I make a motion that Stratford City Council sends a letter to the province asking for more flexible timelines on funding for things like affordable housing and supportive housing? I don't know how exactly we'll word it, but we could get hopefully some help from staff.
I think it's a good idea because maybe we could use this as part of an example of how, you know, we had to respond by the end of January, but we didn't find out till after. So that, especially in smaller municipalities, we don't have the staff or the, you know, like, it's not like, anyway. What does staff think about that?
So through the chair, I will give you what we are seeing. We have received 3, which we are very grateful for, 3 rounds of social service relief funding. We do not know where it's coming, when it's coming. We do not know if it's coming. And we do not know whether it's operation or capital. So depending on the guidelines, just as so this last year, we find out that it's coming and we have it at the deadline, and it is very prescribed as to how it is spent, which may not meet all municipalities' needs sometimes.
So if I may, Bonnie,
Yeah.
maybe I can refine. So I would like to make a motion that the Stratford City Council sends a letter to the province asking that funding that comes is predictable, stable, and flexible, both in scope and timelines involved with the projects. And that would be the motion, just that. But then we'll get some preamble from staff in the letter about what the challenges are from the municipality. Is that reasonable for the recording secretary? I sometimes don't get these right.
I see, Kim, you're nodding your head. That sounds like a better motion. Better way to approach this.
Through the chair, the language is understandable that way, yes.
Okay, anybody got any questions on the motion? All in favor? Carried. Thank you, Kathy. Update, report of the manager of Ontario Works, that the report entitled Update on Social Service Relief Funding be received for information.
So through the chair, Alex, would you like to speak on this report and so we can see? Yeah.
Afternoon, Council. Through the chair. So as we were just discussing with social service relief funding, we were fortunate enough to receive 2 rounds of funding last year. One of them was received shortly after the pandemic was declared. Second phase that we were unaware of after the first phase was provided in September. So we brought reports to you at that time regarding the business cases we were submitting. So we just kind of wanted to come full circle and advise you of where some of that funding ended up. So as you'll see in the report, one of the primary things funding was spent on was emergency accommodations for individuals in our community. There has been an increased need, as noted. There was about a 300% increase over what our busiest nights would be on a standard year for emergency accommodations in our community. As you're all well aware, we utilize local motels as opposed to a bricks and mortar shelter. And then we utilize service manager staff as well as staff from other agencies to support individuals who are residing in those hotels and look at rehousing efforts. That's been a continued focus throughout the year. I think some of that work has paid off. We had 59 move-ins from the course of March 1st to the end of January. And that was from our population that's experiencing chronic homelessness, and the numbers that were reported up to Built for Zero. That's a really positive move. We saw some fluctuations month over month, as you would expect. Had one really extremely successful month with almost 15 movements in a single month, just showing that there's a lot of work being done by a lot of agencies, and I think a lot of credit is deserved for a lot of these agencies in our community that are working to support these individuals. Aside from emergency accommodations, there was also isolation requirements for individuals who either had symptoms of COVID-19 or required to isolate while test results were returned. We do have a partnership with a local motel to provide isolation services, as well as internal processes and an outbreak management plan to work through to ensure that isolation services that are provided are safe, that all the needs of the individuals who are isolating are met, food is provided, clothing and other essentials are provided while they're in emergency accommodations and while they're in isolation, and then supports provided if they are positive in conjunction with public health to make sure that support is provided throughout the extent of the time that they're required to isolate. Further to that, we also were able to transition one of our intake positions into an outreach position just to meet the increased need. And then that funding was also used to fund, as you'll see, there's a list of some external positions that were also funded. Either this was a full funding was provided through this portfolio, or partial funding was provided through this portfolio. So I'll just quickly kind of go over, I won't go into too much detail as it's in the report for you there. The first was 2 intensive case managers through our SHOP program. So we were able to increase the caseload of the SHOP program by another 20 participants in the scattered site model. So intake has begun. So intake is staggered through that program. So there will be intake over coming months to build those caseloads up to the 10 participant caseload. There is portable housing benefits available for each of those individuals accessing that program, which is a really positive thing for us to see, knowing that there's not only supports available, but there's also housing allowances available through our Home for Good funded SHOP program. Secondly, we were able to partner with the Huron-Perth Healthcare Alliance for a few of these positions. We acknowledge that health is extremely important. Having them at the table is extremely important. And having health that goes to where our clients are is probably the most important thing in all of this. Being able to meet them where they're at and provide services in the community. So the first was through the MSIR program, the partnership with Huron-Perth Healthcare Alliance and Stratford Police. We were able to increase the full-time complement in a partnership with those agencies. And even more important to it was the nurse practitioner program that we were able to. So Huron-Perth Healthcare Alliance was able to approach us with the nurse practitioner program through some funding they received. And we were able to kind of partner our funding and build off of that, and also make sure that program was mobile. So that clinic has been mobile since about mid-January. They've been going out to the hotels. So nurse practitioner, a pharmacist, and paramedic have all been on site looking after primary care needs, looking after medication management, and also providing support for any immediate needs that may come up through an emergency standpoint from the paramedic side. It's been an extremely valuable partnership. We have seen healthcare needs being focused on with some of our clients that we have previously not seen, and some progress with regards to medication management that is really positive for us to see, and some strides being made that really help to look at along the continuum of moving towards housing, knowing that medication management can be extremely important to moving them into permanent housing down the road. So there's been a really big focus turned to those immediate healthcare needs as well. We were able to pilot a realtor program using a local real estate professional. We're still waiting on some of those final numbers to come in. It wasn't the most successful program. We gave it a shot. We wanted to see really what that would look like. Unfortunately, we didn't see that many. At this time, we don't have any leases signed, but the nice thing is we were able to drum up a lot of interest with property managers that historically were not willing to work with us. And they may have had a historical view of programs in the community that we were able to kind of dispel with this program. And the realtor that we were working with was able to work with them and let them know what's changed over the years with this program and what has changed in the city so that we can offer up different programs. And some of that education piece was invaluable and something that we're going to continue to build off. There's still follow-up being done to fully wrap up the program, and I can always bring a report back with a further update at a later point. The last thing we wanted to highlight was just partnership with local agencies. So we were able to partner with Family Services Perth Huron to enhance counseling services that are available. United Way Perth Huron to provide funding to not-for-profit agencies in the community, a few of which are listed in the report as well. And then we were also able to provide food, so 2 meals per day since the beginning of January, partnered with the local, as well as a fruit bag delivery once a week for individuals that are accessing emergency housing supports. And then lastly, we were able to enhance our rent bank program that we have available in the community. So we have a COVID-19 rent bank. So if someone does not qualify for our standard Chippy rent bank, whether that's because of income too high or the amount of funding they're trying to access is too high, we had a separate program we're able to steer individuals toward. And that's also in partnership with United Way through some funding that was available. So we're continuing to provide these programs. We're continuing to build off of these programs. All in all, it was very beneficial to have the funding last year. We were able to provide a lot of things that historically we have not been able to do with the Chippy budget that we normally work with on a yearly basis. So it's very beneficial. It's very positive. We're positive to know that we're thankful to know that we have some funding this year to continue building off the successes of last year.
Very encouraging. Our community is just amazing how it works together like this. Kathy, you want to?
Yeah, I had a question around vaccinations, because I really like that idea of taking services to where people are, but also sort of taking services to where people are in terms of trust of healthcare providers and system. And there may be, I mean, you know, you can talk about vaccine hesitancy, but then it's just vaccine accessibility, like how, so would some of these partnerships also be involved in ensuring that clients have access to vaccinations as they come available, or working with the health unit when and if they start doing some mobile units about getting vaccinations to where people are? I'm thinking specifically with some of the homeless population that we have.
So through the chair, Alex and I have been attending, we're going on to our third meeting in regards to this. The current team is the outreach workers with us. It's about relationship development too. So the paramedics, the outreach team, and the health unit I'm just going through, and we've had choices for change at the table as well to ensure that we are doing a mobile strategy for those who cannot be booked into the Rotary complex or who have the hesitancy. And the goal is not only to put them out where to the spots, the motels, but to even expand it ideally to the community housing buildings. And our long-term goal, again, if when we're seeing success with these relationships, is this will be a team that will go, as Alex says, not where the clients aren't coming to them, we are going to the clients. So a lot more outreach than inreach is what our goal is with these teams. So yes, that is the goal, and I'm fairly certain we'll be successful in mobile vaccination.
Perfect, thank you.
Anybody else have any questions or comments? Or I think it's wonderful that you're doing, and you know, I mean, it wouldn't be possible without all of our community partners that we're working with, like United Way and the Food Center and the Health Unit and Family Services. Anyway, let's see. Lost my spot here.
Through the chair, I just want to also reiterate that the expansion of hours is very important for weekend and night. So that's because that's where we were looking as well. Is to ensure that services where we could not just be Monday to Friday, 8:30 to 4:30. So as Alex mentioned in that, so those are some of the things we were looking at as weekends and some evening work as well. And we are very grateful for our community partners for this.
Yes, for sure. Anybody else have any comments? Or Jody?
Yeah, I just wanted to say I think you guys are doing a great job. And so what I'm taking is that you're going to take the third round of funding and just sort of extend these programs, continue them, or look into similar type of programming with the third round of funding.
Through the chair, we will, yes, we will continue the programs, but we're looking at actual additional resources to where we're still seeing some gaps and hoping to partner with a couple other agencies at this point where their strengths are within those realms.
That's great. Thank you. And I'll move the staff recommendation too.
Thank you, Jody. Graham?
Yeah, thank you. And yes, congratulations to everybody involved for doing this great work. I just wanted to make a special shout out to the local, who I understand during these pandemic times have actually more than tripled their output of meals. Based on staff alone, there's very few volunteers involved, so if any. So it's quite an achievement in these times.
It's very hard, and we have a lot of people that live alone and are used to being able to go to the local to socialize, and so at least to have a meal or two a day makes a big impact. Yeah, it's rough times for sure, and I'm sure the government would be really impressed with what you're doing with the money, and we'll see the benefit of, you know, extending money like this and us being able to reach out and to help people, especially people that don't have phones and computers and, you know, day-to-day things that some of us take for granted, you know. Anyway, it's been moved. All in favor? Is there anything else you want to bring up?
To the chair, I can't think of anything at this point, unless there's any questions that anyone would like to ask. I have both the Ontario Works and the Housing Manager on. We will be seeing, I should mention, with the latest news of the schools, we will be seeing a transition back into emergency childcare. So my Children's Services Manager is busy making sure that we are doing that in a timely manner so that the children will be having emergency care as soon as possible.
Yeah, I really worry about that. I wonder how parents are dealing with that, you know, with having to find childcare and, you know, schools being shut down. It must be really hard for some. I don't know what they're doing, but anyway. Does anybody else have anything they wanted to ask or bring up? Jody?
Thank you. Yeah, I had a general question, I suppose, about evictions. Is there a freeze on evictions right now? And I'm just curious as to what our strategy might be if there was some legitimate reason why somebody might need to be evicted. What are the steps that we can take? Or are there any steps that we can take?
So I'll answer, and then Eden's going to fill me in because so yes, with this latest declaration, there's a moratorium on evictions. Yes, we did have evictions in the queue, unfortunately, that had gone through, and they are on pause. So the matter is how to ensure the safety and manage behaviors while we get through this latest lockdown. And it's about putting in, you know, safety supports, safety planning, and community supports.
Have we? I think we have, but I just want to double check. People that are having issues that are causing us to have to evict them, is there support for them to help change their behavior? And have we had any successes? I know that takes a long time. It's a long-term project, but
The short answer is yes. Yes, we do. We do have. It's voluntary though, and many of the services are voluntary. So it's whether we can coach, counsel to attach the right service, and that they will engage in services. And absolutely, Bonnie, in my 20 years, we have had successes. And Eden, do you want to add to that?
Through you, Madam Chair, we are in the housing business. Eviction is a last resort. Housing stability is our key. We know that when we evict from subsidized housing, we do not do this lightly. This means we're evicting somebody into a period of homelessness. And so And I will be honest, the landlord tenant board knows that too. They know that we are a landlord. They know that we have a number of community supports. And so they ask us about that when we go. So typically by the time we've gone, and this particular incident that I can use that Kim was talking about that we've had to delay, this was 1.5 years in the making of an eviction, right? Like this was multiple referrals, door knocks, trying to warm handoff to community supports. But when it is a situation that unfortunately impacts, let's say there's 40 tenants in a property and we have one person who's disturbing the safety of all other 39 tenants, that's usually when we make that decision. But even we're not done with the individual because we are then working with them through Alex's program. So one of the things we've done that's been very successful, I would say, through the SSRF money is helping people with large arrears to cover that off. And also we've been partnering with groups like Family Services to come out to the buildings and run some group counseling. And right now it's sort of, they'll set up a table outside and bring coffee and hope that people will come out and talk to them because we can't do that in the buildings. But yeah, not a light or easy decision.
Oh, thank you for that. I'm sure it's very hard. I've been involved in a couple myself many years ago and it was emotional. I don't know how you deal with it every day. But anyway, hopefully you guys are talking to people too and keeping yourself healthy. Does anybody else have any comments, questions? Okay, I guess we're looking for adjournment then. Kathy? Did you have anything else you wanted to say, Kim?
Sorry, I was waving goodbye. Not bad time.
Enjoy the rest of the day. Okay, all in favor? Carried. Thank you very much. Great report.